Hi, I'm Peggy Kraus. I'm a Jumpstart 360 instructor. I am a clinical exercise physiologist, and I am a diabetes care and education specialist. And in all of those roles, I help people to prevent chronic disease, but I love to help them manage it with the intent of reversing it. Type 2 diabetes is my favorite, and I have had some really good patient outcomes. For instance, um, one of my patients was 428 pounds, and his A1C was 10.1 when he came to me. And within 9 months, he had dropped 200 pounds, and his A1C dropped to 5.3. And not only that's not the end of the story, I should say, is because during COVID, he dropped his weight to 190 pounds and his A1C was 4.8. That's terrific. So let me tell you a little bit about how type 2 diabetes develops. So over the years, and it's no big secret that over the years we get heavier. We pack on more pounds, and every 10 years, we're 7 pounds heavier, 10 pounds heavier than we were the year before. So that is why 70% of our population is overweight and 40% of Americans are obese. It's because we eat too much fat. And as Dr. McDougall says, thanks, Dr. McDougall, the fat you eat is the fat you wear. So as we eat more fat, the body naturally takes that fat and stores it in adipose tissue. Adipose tissue is the natural storage form for fat. Right? The body doesn't like to burn fat calories readily. It loves to burn carbohydrate calories. But it likes to take fat calories and stores them in the adipose tissue. But there comes a time when the adipose tissue sort of screams back and says, enough. I've had enough. I cannot store any more fat here. You've got to put it somewhere else. So where the body decides to store that extra tissue really depends on your hereditary background. So what your genes are telling your body to do. And if you have a predisposition for type 2 diabetes, your body will take that extra fat and put it in the muscle cell, right? That's intracellular lipid. And when the body fills the muscle cells with fat, now you've just filled up any room that glucose can occupy as it moves into the cell. So the glucose has to go into the cell so that the cell can make energy from it, right? But if the body fills that space with fat, the glucose can't go inside the cell. So what does it do? It stays outside the cell in the bloodstream. And when you go for a blood test, the doctor sees that number's elevated when he looks at your results. Okay? That's type 2 diabetes. And again, how did it happen? Eat too much fat, the body stores it in the muscle cell, no room for the glucose to fit in then, so the glucose stays in the bloodstream. We measure that in the blood test, type 2 diabetes. But if you're a person who maybe has a predisposition for atherosclerosis, right? That's fat being stored in the arteries. So maybe then your body is taking that extra fat and doing just that. It's storing it in the arteries. So what happens if the fat builds up in the arteries, right? That's plaque. You get an obstruction. And when there's an obstruction to the heart, that's a heart attack. Obstruction to the brain is a stroke. That's not good. What about if you have a family history of dementia or Alzheimer's disease? Then your body just might want to take that extra fat and store it in the brain. Things don't happen well when you have fat stored where it doesn't belong, right? We call Alzheimer's disease now type 3 diabetes. because that's what happens. We're storing fat in the brain rather than in the muscle cell, right? In the muscle cell is type 2 diabetes, in the brain, type 3 diabetes. The interesting scenario here is what happens if you have a history, family history of liver disease, right? Non-alcoholic fatty liver disease. So we're not talking about liver disease come from alcoholism, right? We're talking about eating too much fat and the body storing it in the liver, okay? So there are 4 stages of liver disease. And stage 1 and 2, the doctors don't even tell the patients that they have stage 1 or stage 2 liver disease. Okay, why? Because so many people have it. But stage 3 is now where we have to get serious, and this person has to limit their protein intake, they'll limit their fat intake, whatever treatments come down the pike for liver disease. You know what, stage 4, if it progresses, end stage liver disease. You know, all reversible, all preventable with the same diet. It's a low-fat, plant-based diet. Low fat, right? Because we don't want to keep shoving fat inside those cells, whether it's the muscle cell or the artery or, right? So low fat, high fiber, because the fiber will work like a scrub brush and it'll scrub out that fat from inside the cell. So what's going to happen? The fat leaves the cell so that the glucose can fit in, right? And the cell can use it for energy. Muscle cells need energy, brain cells need energy, liver cells, everything, every cell in your body has mitochondria. Those are the powerhouses of the cell, and they need glucose to make energy. So there's a phase that I missed in between storing fat in your cells and being diagnosed with type 2 diabetes, and that's insulin resistance. So insulin resistance happens when your body just is not using the hormone insulin properly. So we say it's sort of resistant to insulin. And that's to say that because fat has confused the cell. Fat has confused not only the cell, but the tissue that it's part of and the body that you have. The body doesn't know how to make insulin. Insulin is a very important hormone, very important. Without it, you would die. That's why people with type 1 diabetes who cannot make their own insulin, they need to take exogenous insulin, whether it's from an insulin pump or from syringes, but they need it. But insulin is a mover. So it moves glucose into the cell, it moves fat into adipose tissue, right? It moves things around. So insulin resistance is the beginning of type 2 diabetes. And there's a whole story behind that. But what I wanted to spend this time on is to talk about type 2 diabetes, how it develops, and how can we fix it. We have to get to the root of this problem, right? To give you medication, more medication every year, just because, how about this? You're eating the American diet, right? You're filling up those fat stores with those cells with fat, and your glucose numbers go up. So what do? You go to the doctor gives you a prescription, diabetes prescription. You go home, you take it, your blood glucose numbers come down, but you continue to eat the fat. In a year, you go back and your blood sugar numbers are back up again. So what happens? He gives you a second prescription for diabetes medication. So now you're on 2 medications, 2 different medications, and you go home and you take the medication for a year and you continue to eat the fat, and your blood glucose numbers go up again, and then you get another medication. It's not fixing anything. We need to get to the problem. We need to get to that intracellular lipid that's in the muscle cell. We need to get that out. High fiber, low fat diet. We can use exercise. Exercise is so important because it doesn't need insulin to work to get the glucose numbers down. Exercise is sort of like is rhythmic contraction of the muscle, and that sort of squeezing moves the glucose into the muscle cell without insulin. It doesn't need the mover there. The mover is the rhythmic contraction. So exercise is very helpful. Interval training, resistance training, regular continuous aerobic training, all important. Go for a walk. Use some resistance bands. All that stuff is so good for you. Proper sleep, stress management, because those two things can also raise blood glucose. That's your recipe for reversing type 2 diabetes. Thanks for listening. Bye.